I teach therapists I work with what I call ethical retention. That's getting the patients who need to come back when and as often as they need to get maximum benefit. I do not condone over-treating. That's a quick way of getting a terrible reputation. Now that I've made that clear, let's look at some common perceptions in the therapy world. Firstly, you are not doing people a favour by not rebooking them if they would benefit from further treatment. So many therapists who hate rebooking will justify it to themselves and others that the patient didn't have the money to come back or didn't want to come back again. In essence, you've done them a favour by not rebooking them. Except you haven't. You've failed to give them value for money. In fact, you've taken some money from them and failed to deliver maximum benefit to them. Next up, the patient should decide whether or not to come back and when that should be. That's fine if they know everything you know and understand it perfectly. The problem is, that's very rarely the case. As such, they're looking to you for guidance. Would you expect your mechanic to ask you what you'd like them to do to your car? Quite simply, most patients do not have enough knowledge to be able to decide when or if to come back. During a session, you're trying to educate them to give them enough knowledge so that they can understand your reasoning when you recommend further sessions or the best course of treatment. If you ask a patient, do you want to rebook? That instantly suggests that you don't know whether they really need to, or it's not absolutely vital that they do. When I see a patient and agree a powerfully passionate goal, I need them to come back. I desperately want them to come back so that I can help them get to that goal. Do they want to come back? Probably not. But they know they need to. Then, over the course of the following sessions, I get them to want to come back. That's what this course will teach you. Okay, next misconception that is common in clinics everywhere. The patients can't afford treatment. Well, usually they can, otherwise they wouldn't have come in the first place. It's very rare that people can't afford it. What's infinitely more common is that the therapist has failed to get the patient to perceive that there is a higher value in coming back than the cost, i.e., the cost is much less than the value of the session. If you don't show the patient the massive value they will get from further sessions, they will often see it as too expensive and claim they can't afford it. I understand that therapists don't like asking for money for their services. Most therapists got into the profession because they wanted to help people, not take money from them. However, the simple fact is that if you work in private practice or have your own business, you need to take money. And you should be paid for what you do. Therapists forget their value. You fundamentally change people's lives for the better. Doesn't that deserve some form of payment? When you put it like that, most therapists will agree that it does. But most therapists don't think like that. Most therapists downplay what they do. They're just doing massage or physio or whatever, and they're not so sure that it's worth ongoing payment. You have to reframe how you think. You have to see the value of what you do. That's where the goal-setting section of this course will change your practice forever, because you'll see what you do as vital. As soon as you see that, and link that to why you're doing each treatment, or why you're recommending more sessions, it gets a lot easier. Probably the last preconception that really gets in the way of rebooking is that people expect their patients to follow their advice to the letter and make logical decisions. And they expect that they got their diagnosis, treatment, and exercise prescription absolutely perfect. And that the patient will react in exactly the way that their injury is supposed to. That's a lot of assumptions. Sadly, patients don't act logically. You can't bank on them to do their exercises how you showed them, or as often as you told them. You can't assume that they won't do the things you recommended they avoid. You cannot get every diagnosis right, and you can't get the treatment right all the time. And anyone that claims to always get the right exercises prescribed at exactly the optimum intensity, duration, and frequency first time is a much better therapist than I will ever be. So, even if you think a patient just needs to strengthen a bit, do you know they'll do their exercises you've given them? No. Do you know that the exercises are perfect for them? No. So you need to check by seeing them again. Because that way you can hugely increase the likelihood that they're going to get better. You can get their feedback. You can check their compliance and buy-in. You can progress them however they need to be progressed. In short, you can increase how likely it is that they'll get benefit from treatment simply by seeing them again. I'd much rather check on someone, keep guiding them and keep them on track until such a time that I know they will progress how I want them to. If I can't give them any possible extra benefit, then is the time to discharge them or not rebook them, not before. Some people disagree with me on this and say that they hate selling treatment. There is no need to view this as selling. This is simply recognising that you're a vital part of a patient's recovery, which they're unlikely to manage without you, and so you're giving them the best possible chance of success. Nothing in this course will train you to get patients to come back when they don't need to. It will, however, help you create an experience at every session that makes the patient want to come back again. That makes it a lot easier for you to rebook them without having to feel like you're trying too hard. One last point on rebooking before we start the course. I want to talk briefly about frequency of booking. A lot of therapists book in blocks of weeks. The earliest they'll ever see someone is a week, but more often it's 2 weeks, and that, of course, is assuming they rebook them at all. They do this because of the documented healing times, a concern about asking someone to come back again too soon, a lack of confidence, all kinds of reasons. The problem with this is, whilst you might be following the evidence, you're again making assumptions that the patient will follow your advice to the letter and you're the perfect therapist. What happens if something isn't quite right? If you don't see them for 2 weeks, you might have wasted 2 weeks. They might come back with no change at all because they weren't doing their exercises correctly or you got something wrong. If you see them again in 3 or 4 days, however, then you'll know much sooner whether you're on the right track and that the patient is engaged. Therapists often don't have confidence to do this. What if the patient doesn't get better? Well, then you've realised far sooner and you can try and change things to get them improving. If they are getting better, then you can progress things sooner. Either way, you're going to get to an end point sooner. Every therapist I've challenged to see their patients more regularly has been resistant. Equally, every therapist who has followed my advice has been amazed at how much better their results are. Simply by seeing their patients more frequently initially in their treatment, they have much more control of the process to keep the patient on track. But also, the patient perceives that the therapist is more engaged. I'm not saying seeing the patient more times necessarily. Because of the better carryover between sessions, the fact that the patient will be consistently doing the right things, and because they feel they have an expert guide, you will often see quicker improvements. That means they get better quicker, so often you'll see them 4 times in 2 weeks, rather than 4 times in 4 weeks, for example. You get the same result, but in half the time. Everybody is happy. The patient feels like he's made quicker progress than expected, and the therapist is delighted at the result. Use this course to learn how to create the environment and experience that will encourage the patient to rebook and to follow your advice. Then use your clinical reasoning to guide you, but then acknowledge the human aspect in this and see your patients a little more often than you normally would have. Also, until you're totally convinced they will follow your advice to the letter and that you're spot on with your exercises and treatment, then make sure you see your patients again. Don't desert them in an effort to do them a favour. Make sure you cannot give them any extra benefit at all from another session before discharging them. If you can help them any further, you have to explain that to them, otherwise you're falling short of what you could have offered. Okay, I hope you enjoy the course. Use it to learn how to ethically retain your patients. This works for whether you're seeing them in person or as online consultations and can change your therapy business and help patients achieve better results. See you in the first section where you'll learn what barriers you're putting up that are stopping your patients from engaging in their treatment.